Jason. I'm a paramedic nurse, and in the last 7 or 8 months or so, I have had 5 spinal surgeries. The first 4 were with Bonati Spine Institute, and the 5th one was with Dr. Garber. All of them out here in Las Vegas. And in this video, I'm going to try to just share my experiences and the details that you learn after you go through the process so many times, the mistakes that the misunderstandings and mistakes that I made, and the things that you hear while you're going through the process, because you could be in so much pain that literally you don't remember your office visits. I was in so much pain, I didn't remember the instructions that they gave me. I misheard the instructions. I was taking 10 milligram Percocets a day for the pain. I'm off all pain meds now. I'm off all pain meds. And I'll tell you, the withdrawals are bad. But in terms of surgical procedures, and in terms of the doctor's experience, one of the things that didn't occur to me is that you could be, and I'm a paramedic nurse, and I didn't even catch this, going the whole way through. One of the things that didn't occur to me is that when somebody's a surgeon or a neurovascular surgeon, not all surgery is the same. Listen, as a paramedic, I show up, I'm not doing any surgery, right? I'll pick you up, take you to the hospital, treat you on the way, possibly even save your life. As a nurse, I'll go in and I'll treat wounds and patients. But when you get hurt, if you don't already know, there are things that you're going to miss. And one of the things that I missed was specifically this. Now, I went to Bonati Spine Institute. Super nice. I mean, same day appointment. They got you in. I mean, they looked at the x-rays. They were ready as soon as I was, and I was on the table within a week. The doctors before Bonati, dude, they kept sending me out for treatments, and they kept sending me out for diagnostic treatments where like MRIs and x-rays. Bonati looked at the x-ray and they understood. Like, as a paramedic, I understand. Sometimes things are much more critical than others. And where the first doctor was like, this was Dr. Muir and his assistant, the physician's assistant, they looked at me and they were like, well, let's do more tests. I showed the same video to both Bonati and Garber. And Garber was like, immediately, they made surgery ready for me within 30 days. The Bonati Institute had me on the table in 7, and I was in so much pain. I can't tell you how attractive 7 days was. So I went with Bonati. But this is my surgeon, and he did, in terms of surgery, I never got an infection. I felt better after every surgery, and I made a video about why I think I felt better after every surgery. I mean, he did something. Even on the x-rays, you could see that there was much less disc removed. And I'm working on getting the x-rays because I'm going to show you the progress. Because I looked at the x-rays after the first one, and I'm like, yo, you can still see disc where you guys said it's all supposed to be out. You could still see it. And he showed me on the x-rays where he did the surgery. And I said, listen, but you could still see it. You could still see disc that doesn't look like the ones above it. Because I have an L4, L5 fusion from 25 years ago. And Bonati just talked smack about fusion. And so did the other 2 doctors, Garber and Muir. They talked smack about fusions as well, but my fusion lasted 25 years. And all I was doing when I hurt myself about 8 months ago, I was just stretching. I was just stretching, touching my toes, putting my leg up like, ballerina style and touching my toes. I wasn't trying to, I'm 48. I wasn't trying to recapture my youth. I wasn't trying to be 21 again. I was just trying to be a little more limber. And I got hurt just from that. And it blew out in the disc just above it. Like every doctor I went to said, oh, you went 25 years with a fusion? And Bonati talks a lot of smack about fusions, statistics and all that, whatever it is, they talk a lot of smack. And I just want to point out, this is my surgeon times 4. Love the guy, great guy, super nice. You believe in him. And I had 4 surgeries. Now, The first surgery put me in the hospital for 4 days. When I came out of the first surgery, the pain was so great that it was blinding. They were surprised, I was surprised, and looking back now, after 4 surgeries, where 2 of them shouldn't have even been done, and 2 of them had to have been redone by a spinal surgeon, I'm even left to wonder if something went wrong in that first surgery that put me in the hospital for 4 days, or if it was just because the decompression freed up blood flow. There's no way for me to ever know. But I had 1 surgery, the first one, and it was on the worst spot that put me in the hospital for 4 days. And when you read, I mean, this is chairman of neurosciences at the Naval Medical Center, principal investigator, experience includes emergency department physician, neurosurgeon, certified by the Board of Neurological Surgery, served a surgical internship. There's all, I mean, the guy's, listen, the guy's awesome. Loved the guy. It's the results that I'm complaining about versus what was promised me with Bonati, because I went to this company next, and this doctor, this is Western Regional Center, and this doctor specifically, Jason E. Garber, and he redid L3, L4, left and right side, and I woke up from that surgery and I knew, I could feel the pressure was gone. Now it's been about 17 days or so, 18, 19 days. I'm making these videos. I make a couple a day. I'm getting stronger every day. I'm in less pain every day. That blinding hip pain that I was in, that I was having just going from sitting to standing, was it reduced in the first surgery that I had with Dr. Grossmith? Hell yes. In fact, it was reduced so much, it took me out of the suicidal scale. You know, it took me out of that position. I'm still laying down. I mean, it's been 9 months, and I'm still laying down every day recovering from the 5th surgery. But I went to this surgeon, and when I woke up from surgery, if you watch some of the other videos, like one of them's called Witchcraft and Steroids, and I don't think Dr. Grossmith or Bonati uses steroids. They told me that they didn't. But when I woke up from the one procedure that Dr. Garber did, I immediately knew that the pressure was gone. The radiating pain. I was walking, standing up. I listen, I'm still bending over and getting radiating pain 19 days post-surgery. I'm still having some of these problems. But, I mean, I just had surgery, and I've been getting better every day since this 5th surgery in a way that I never got better from any of the Bonati surgeries. Never. I never got better in the way that I did after I had surgery with Garber. And I was in a rough position when I went to Bonati. I was suicidal. The people, the color. One of the things that people said to me a couple of weeks after the Bonati surgeries was that my color was starting to return. But I didn't have the freedom of movement until I had that 5th surgery that redid the 2 Bonati surgeries by Dr. Garber, and this guy. And listen, he had commented, you know, he was never pleased with Bonati. He was never convinced. He said absolutely not. He said absolutely not. Like, you know how I'm telling you, like, there's no mention of spinal surgery here? Well, in Dr. Garber's review, it is neurosurgeon for brain and spine, where he concentrates on the treatment of complex spinal disorders. It is in the first sentence, complex spinal disorders. And the North American Spine Society here as well. And so, right here, during his neurosurgical residency training, Dr. Garber developed extensive surgical expertise in the treatment of degenerative and traumatic disorders of the cervical, thorax, lumbar, and sacral spine. Right there. And I didn't catch this until after the surgeries and I was feeling better, and after the Dr. Garber surgery. I would not have thought to look at the websites for those specific words. After the surgeries, when I'm sitting here and I'm getting better every day, I look back on it, and I'm a paramedic nurse. I'm a paramedic nurse. And I missed it too. And so I miss the difference. I miss the relationship too. One puts spinal surgeon first and foremost in his description, and the other one talks about surgery. And so I just want to point out, both doctors, super talented surgeon. One doctor, spinal surgeon, had to fix the other surgeon's. He had to rework, fix, redo the other surgeon's initial, surgeries that they did with me. He had to go in and do it again. And I truly believe, now that all the surgeries are over, I truly believe that there is a difference in that. I just don't believe that they're the same thing, although I believe that they're both talented surgeons. I just don't believe that the experience is the same. Now, Bonati, to some extent, seems to me like when they were talking with me outside of surgery, when they were talking with me, they really seemed to be very franchised, where they came from Florida, moved out to Las Vegas, brought people on staff, built a business, and that it really seems to be kind of franchisey, where Dr. Bonati, and this is the individual who, in one of the other videos, one of the other review videos, I was talking about the Bonati lawsuits. This is him. He teaches to someone else, but then I go to the doctor, and in one of the other videos I was talking about, I'm specifically telling them the pain is bilateral right here on both sides, literally just like this picture shows you. Right above, like just a little suprapubic right there with that L3. Blinding pain. And the pain doctor that I went to said, oh, it's L3 in the hips. It's L3. Muir, who dropped the insurance and was stalling with diagnostic tests, L3. I mean, the x-ray showed L3. Bonati did surgery on L3. But the pain never went away until Dr. Garber performed the surgery on me, the spinal surgeon, rather than a surgeon who's been educated on how to do this. Like, I almost imagine like a weekend seminar. You know what I mean? He goes there, he does it for a weekend, he comes back, and I for sure didn't get the same results, because Dr. Grossmith wanted to do 2 more surgeries, 6 total. He wanted to remove the rods and pins in my spine, because he's like, well, it's not L3 and we did L5, and every other doctor. I even went to the company that said they take your blood out and then they process it and they extract the good stuff in your blood, and then they inject it back into your spine with like a laser. I even went there, and as soon as I told them what my pain was, said L3, L4. Soon as I told them where it was. Listen, that place is a whole nother video talking about that, injecting blood back in. And so I went in and I told Dr. Grossmith what all these other doctors said, and he wanted to remove my rods and pins. I suppose if it was the L3, L4, they would have had to do it over again. But at that point, if they told me they wanted to do it over again, I would not have allowed them. And when the other doctor says it should be done over, and the doctor doesn't know it should be done over, and it wants to remove your rods and pins out, you got to pump the brakes on this whole thing. I was already feeling better at that point, so I was able to not make a decision based on how sick, how hurt I was. All right. I'll have more review videos where I talk about the individual parts and pieces of this. And of course, if you want to find the videos about me and my 5 back surgeries in the last 8 months, you can go ahead and just search Never Bonati Spine. That's Never Bonati Spine. And you'll see my videos. My name's Jason. I'm a paramedic nurse. Just look at that surgery. It is so painful. Listen, I wish you the best. I wish you success faster with less problems than I've had to find success in your pain, in getting rid of your pain. I hope you can get off the pain pills. That was brutal. If you want to catch me on one of my webcasts and talk to me, you can call the number 844-769-2677 on one of my live webcasts. And I'll tell you, Bonati had one of their other customers call me who had 4 surgeries and it still wasn't fixed in his shoulder, and he was in so much pain it was suicidal like me. And he didn't know what to do either after 4 surgeries. He was broke as well. And so if you want to share your story, there's the number. You can leave your experience in the comment section of the video. You can leave contact information. I'll find it. I'll reach out to you if you would like to share your experience, pro or con, good or bad. Leave it in the section. Leave it in the comment section of the video. Search Never Bonati Spine on Google and YouTube if you want to find my videos. And listen, I wish you a speedy solution and an easy recovery. Thanks so much for watching.